Namaste, I'm Dr. Anushree Muralidharan from Divineveda, and today I'm here with a new topic, ulcerative colitis. In this video, I will be talking about the complications of ulcerative colitis and few diet and lifestyle modification needed to take to prevent the complication of ulcerative colitis. Please watch the video till the end to know the diet and lifestyle modification for ulcerative colitis. What is ulcerative colitis? Ulcerative colitis is a chronic inflammatory bowel disease which causes ulcers and inflammation in the large intestine. It affects the large intestine and sometimes rectum as well. Symptoms vary from mild to moderate and its severity depends on the amount of inflammation and the location of inflammation. Sometimes the patient experiences no symptom, which is called the remission period, and sometimes a flare-up of symptom. Mostly seen in men above 50 years of age and in some between 15 and 35 also. How can we identify the ulcerative colitis in a person? Yes, through signs and symptoms itself. Patient is one who is most capable to exactly notice the changes in his body. And that itself is the signs and symptoms. Regular observation will help him to do so. So, let us move on to the signs and symptoms of ulcerative colitis.
Abdominal pain, blood in stool, abdominal cramps, diarrhea with blood and pus, canker sores, anemia due to excessive bleeding, abdominal sounds, urgency to defecate. In severe cases, incontinence is also seen, fever, fatigue, weight loss due to the inability of inflamed colon to absorb food. In some rare cases, the following symptoms are seen. Uveitis, it is the inflammation of uvea or middle tissue layer of eye. Episcleritis, it is the inflammation of episclera, which is the clear layer on the top of white part of eye. Erythema nodosum, it is the inflammation of skin with painful and tender lumps. Other symptoms are reduced appetite and dehydration due to loss of fluid and nutrients due to continuous diarrhea.
If these symptoms are not identified on time or ignored, or if not treated properly, it may lead to complications. Complications also occur in a person who follow unfavorable diet and lifestyle pattern even if he regularly takes medicine. So let's see what the complications are.
Severe anemia is seen in cases of continuous bleeding. Intestinal perforation due to long-standing inflammation. Fulminant colitis, which is a rare form of pancolitis due to extensive infection and inflammation leading to bursting of colon, which is a medical emergency. Toxic megacolon. It is a complication of ulcerative colitis in which colon swells and become dilated. It is also a medical emergency. Liver disease caused by inflammation in the liver and nearby ducts, which result in scarring in the liver. Osteoporosis. Colon cancer. There is an increased risk of colon cancer in patients who suffer long-standing or chronic ulcerative colitis. Some patients develop arthritis, especially in sacroiliac joint and other vertebral joints, with a classical symptom, low backache. Rarely, patients experience inflammation of eyes and red eyes, which may lead to vision impairment. Skin inflammation and red nodules in the skin are also seen in a few.
Ulcerative colitis is not a fatal condition, but in some rare cases like pancolitis or acute colitis, it may lead to life-threatening complications. But if ulcerative colitis is taken care from beginning itself, these complications and tough surgical procedures can be avoided. But it also requires proper diet and lifestyle modifications, proper intake of medicine, and a stress free life. So let us move on to the most important and interesting part of this video. Yes, diet and lifestyle modifications. A person with a first degree relative suffering from ulcerative colitis can also follow this diet and lifestyle pattern in order to prevent ulcerative colitis in future. Firstly, I'll tell you the food that an ulcerative colitis patient should stop taking.
Food which increases ama, like oily and greasy food, dairy products, etc., should be avoided. Avoid citrus fruits as they are sour and acidic in nature. Avoid alcohol, caffeine, carbonated drinks, spicy and salty foods because they slow down the ulcer healing process. Non vegetarian food should also be limited as they take much time to get digested. Limit the intake of high fiber foods like whole grains, few vegetables like lady's finger, and some fruits. Always take cooked vegetables because raw vegetables are very heavy to digest due to the presence of fibers in it.
Now let's see the foods that an ulcerative colitis patient can have or the food which subside the symptoms.
Coconut water is the best ulcer healing and soothing drink. So replace caffeinated drinks and carbonated drinks with coconut water. Milk responds differently in different people. In some people, it aggravates the symptom, and in some, chilled milk gives relief. Try to understand how your body responds to milk and consume accordingly. Buttermilk with fat entirely removed and which is not sour is a much recommended drink in all gastric disorders. Pomegranate is the most suitable fruit for consumption in ulcerative colitis patients. Other non citrus fruits like banana, apple, pear can also be consumed. Vegetables with a bitter taste is pittahara in nature and is best for consumption. Other vegetables like pumpkin, bottle gourd, snake gourd are also good. Cumin seeds and fennel seeds boiled in drinking water and consuming that water on a regular basis enhance your digestion. If you want some oil in your food, go for healthy options like olive oil.
Now let's see what corrections in our lifestyle can prevent the flare up and recurrence of ulcerative colitis.
Lifestyle corrections to be done. First and foremost is not to skip breakfast. Take food on time and avoid long gaps between each meal. Try to take small meals multiple times. Avoid day sleep because it slows down the ulcer healing process. Avoid too much exposure to sunlight. It aggravates pitta in the body. Replace drinking very hot water with lukewarm water. Avoid taking purgatives regularly to relieve constipation. Instead, go for natural remedies like exercise, walking, and yogasanas which relieves constipation. Avoid too much stress and tackle it by resorting on relaxation techniques and meditation. Avoid taking painkillers for small issues and if the pain is tolerable.
By properly following this diet and lifestyle pattern, definitely the person suffering will experience a change in their condition. So please do follow this. I hope you got something new from this video. So friends, please do subscribe to our channel. Daily we will be posting videos on Ayurveda, yoga, diet and lifestyle correction. And here we will be discussing how to get cured of various diseases that are affecting mankind through Ayurveda, yoga and diet. I hope you enjoyed watching last videos on GERD. If you missed out, you can get it from our channel. If you have a disease or a health issue in your mind which you want us to discuss, please do comment in the comment box below. We will try to come up with videos for the same. Thank you for listening. This is Dr. Anushree signing off.